EOSINOPHILIC esophagitis. All right, the eosinophil, the little red cell, eosin dye, very pretty dye. The symptoms will be just like reflux, but these are the kids that don't get better with reflux therapies. They'll have epigastric pain, they'll have vomiting, but they don't get better with standard reflux therapy. And basically, you do an endoscopy, you do a biopsy, and what you will see is you will see this lining, and it is full of eosinophils. All these red dots, because that's probably what you guys see out there, sitting out there. All these red dots are eosinophils, loaded with it. It's an apparent allergy condition. Those are the type of cells that do allergy in the GI tract. Treatment, well, there's two treatments. You can do an elimination diet in older kids, or an elemental formula, avoid the allergy. Or you can do some sort of a topical steroid approach. There's some newer therapies now online coming for us to use, but basically, most of the time these kids, by that point, you're going to have them seeing a pediatric gastroenterologist. Infections of the esophagus, again, usually something sets you up. All right, you got diabetes, poorly controlled most of the time, HIV, cancer, or they've been on high-dose steroids for something. The most common ones are Candida, or thrush in the swallowing tube, as we like to explain to parents, CMV, herpes simplex. You can get a very rip-roaring herpes esophagitis the first time you get it, after you kiss your aunt who had the cold sore. And they'll show up with some dysphagia, dysphagia, or chest pain.